Hi, I'm Dr. Randy Martin, and I'm pleased to be joined by Dr. Kwon, who is from the Samsung Medical Center in Seoul, Korea. And Dr. Kwon is going to talk to us about the EXCELLENT trial. Thank you for joining us. What's the EXCELLENT trial?
Yeah, EXCELLENT trial is tested the hypothesis that the 6 months duration of clopidogrel therapy is non-inferior to 12 months duration of clopidogrel therapy. As you know, current guidelines they recommend to at least 12 months duration of clopidogrel therapy if the patient is not at high risk of bleeding. But based on no prospective randomized controlled trial, so we tested the shorter duration of clopidogrel therapy, maybe as safe as the current guideline as a 12-month duration.
Well, I mean, it sounds like it's an excellent question, and to take a parody on words, but what did you find? What did you find in the trial?
So our primary endpoint was a target vessel failure defined as cardiac death, MI, or the target vessel revascularization. And we found that the non-inferiority of 6 months was highly significant compared to 12 months, and the target vessel failure rate at one year was 4.4% in 12 months group and 4.7% in 6 months group. So no difference.
Do you think, obviously we can go into different populations, but do you think this is going to change the way we practice? Sounds like it to me if the findings hold up.
Actually, we did test the hard endpoints like death, MI, or stent thrombosis. So we tested just soft endpoints. So maybe we need to wait the larger clinical trials. Until then, we found that in high risk patient subgroup like diabetics, or the risk was higher in the 6 months group, and specifically this study is also randomized to the Everolimus-Eluting stent versus Sirolimus-Eluting stent, and we found that in Everolimus-Eluting stent group, the non-inferiority was also significant. So maybe in low-risk patients and non-diabetics, particularly implanted with the second-generation DES, maybe we can safely discontinue the clopidogrel at about 6 months if a patient is at the high risk of bleeding. So we have some weak evidence, for the discontinuation.
I mean, it sounds very, very interesting. I think the finding on the diabetics is also interesting. But thanks for an excellent trial and for a good discussion. Thank you for joining us.
Thank you very much.